My childcare provider has been like a second family to me, and it's been really important because it's really helped establish my breastfeeding goals.
We put a lot of emphasis on building bonds with parents as they originally come in and talking with them while they're breastfeeding and hanging out in the room and building those connections so that they feel more comfortable leaving their babies with us. And then that trust and bond just follows them throughout the whole center, and they're able to relate with every single teacher, and it just builds more and more, and they're more comfortable here.
Childcare settings can play a significant role in supporting breastfeeding families. The information in this video can be generalized to all types of childcare, including centers, homes, and family, friend, and neighbor care. For more specific information and resources relating to your type of setting, check with your state agency, such as the Colorado Department of Public Health and Environment, or your county, such as Boulder County Public Health. Childcare settings need 5 things to be in place to fully support breastfeeding families: commitment to breastfeeding, ongoing training of staff, an environment that supports and normalizes breastfeeding, good communication, and excellent resources. Commitment can be in the form of a policy or guidelines where good practices and promises to families and staff are documented in writing. Commitment also means creating a lactation space for breastfeeding parents and staff. All child care staff should receive regular education about breastfeeding and training in supportive practices. An environment that includes images and objects depicting nursing animals and humans is important for normalizing breastfeeding for children, families, and staff. A supportive environment will have space for breastfeeding that is convenient for parents and resources for all breastfeeding families. Good communication between staff and families is essential and includes verbal and electronic interactions, clear signage, and clearly written policies and practices. Making resources available to families helps them get the information, support, and care they need, even beyond the 4 walls of the childcare setting.
The daycare that I go to is really supportive of me coming in while I'm working, so they will communicate with me either through text message or phone call. They'll let me know when she's ready to feed or if she's sleeping. They have comfortable rocking chairs with pillows and couches and chairs. It just makes it really easy for me to breastfeed my baby while I continue to work.
Childcare professionals, whether they have specialized lactation counseling training or not, can help families in numerous ways. Setting breastfeeding-related goals, overcoming common challenges, learning paced bottle feeding, which mimics the rhythm of breastfeeding, and properly storing and handling breast milk.
We don't prep breast milk more than we need to, so we make sure that it's just as we go and we don't have to send any home. We make sure that babies are ready to feed when moms are showing up, whether it be on lunch break or in the afternoon, so that their babies are ready to eat. And we also ensure that our parents can serve breast milk to their children as they get older. So in our toddler room, we also allow breast milk so that parents can continue that process as long as they would like. We find it very important to support our staff moms in their breastfeeding experience. One of the things that we do is ensure that her breaks are able to match up to when her baby needs to eat. And if it has to change daily, we roll with that and do whatever we can to ensure that she's either able to nurse her baby or express her milk on her schedule.
Families depend on childcare settings to be that second family while they are at work or school. When childcare settings are committed to supporting breastfeeding families and their own childcare staff, families are better able to successfully combine work or school with the best and healthiest start possible for their children.